everybody. Excellent. Okay, perfect. Right, let me move on to the next slide and introduce everybody. So welcome, everybody. I'll start with myself. I'm Janet O'Neill, and I'm head of our occupational health training called PAM Academy, which is a central part of PAM Group. And obviously, as you will know, PAM Group delivers health surveillance programs to thousands of employers and their employees across the UK. And with me today, I'm absolutely delighted to have Alison Crawley, who is Head of Health, one of our clients, EKFB, FERG Care for Ovarial and BAM. And Alison will be very proud of me for remembering that. And of course, they look after the well-being, or Alison's team looks after the well-being of over 4,500 workers at Europe's largest construction project, which of course is HS2, the high-speed railway link.
Thanks, Janet, for that lovely introduction, and good morning, everyone. Glad to be here.
Brilliant. We've also got Dr. Bernard Yu, who's our medical director. He's been our medical director for the last 10 years, and very fortunate we are to have him in the business. And he is going to help us clarify what occupational health surveillance is and isn't. He's an occupational medicine specialist.
Good morning, everybody. My name is Bernard, and thank you very much for sparing the time to join us today.
That's brilliant. Thanks, Bernard. And last but not least, we've got Anna Porter. She's our Clinical Operations Director, PAM Occupational Health Solutions. And a little nugget of information about Anna. She is the Chief Examiner for the Faculty of Occupational Medicine Diploma in occupational health practice, and she has a specific interest in health surveillance, risk assessment, and preventing the preventable, which we will talk a little bit more about today when it comes to work-related ill health.
Good morning, everybody. Good to be here. Nice to meet everybody.
I'll just move on to the next slide. So these are the areas that we're going to be discussing and debating today, which is the real purpose of health surveillance and work. And in particular, we're going to be looking at these 4 areas which you've got on the screen. So what is, and perhaps even more importantly, isn't health surveillance? How can you identify and design out risks? What are the real reasons employees miss their health checks? And how can you reduce that non-compliance due to managers and leadership? So hopefully those areas will help you to start formulating those questions that you have, and will be popping into the Q&A function. But before we get started, I'm just going to give a little bit of a recap on why does health surveillance matter. And you can read what's on the screen, the numbers that it affects. And these figures obviously come from the HSE, the Health and Safety Executive. And what we do know is that many work-related illnesses are actually preventable with health surveillance. And that's why we really want to have a bit of a focus on it, especially with the right culture. So the next slide I'm going to move on to and hand over to Bernard, who is our, as I said, is our medical director and a occupational medicine specialist. So over to you, Bernard. What is health surveillance?
It's good, Janet, that we're doing this session because there generally is a lot of confusion out there. So it will be good to try and demystify what health surveillance is. So to start off with, health surveillance isn't fitness to work, really. Often they do get clumped up, into the same thing. A lot of employers carry out a check to see if someone's hearing, for example, is good enough to do the job. And if it is, then they would maybe have felt that they've done what is necessary from that health check, which will serve, as a health surveillance tool. But that is not what health surveillance is. Health surveillance is there to regularly monitor the individual's hearing. So, for example, to make sure that it's not getting worse over time due to the job damaging the employee's hearing. So another example would be if someone is working in a bakery setting and exposed to flour dust. Yeah. So it is that regular checking of their lung function, for example, to ensure that the exposure to that dust isn't giving them asthma, for example. So it's shocking that from a HSE report for the period April 2023 to March 2024, it is estimated that around 12,000 people a year are dying from work-related lung conditions alone.
You know, you're absolutely right, Bernard, and a couple of points that I have is that we know that 1 in 6 people with occupational asthma are out of work and have never been able to return to work. And I belong to a respiratory forum on Facebook for primary care clinicians, and just watching what they're saying and asking a couple of questions around, do you see any work-related asthma? They were saying it absolutely. They have seen people with breathing problems that they are treating in their clinics, with, and you know, diagnosed with COPD and occupational asthma, where people are actually exposed to these elements at work, and yet they don't have any health surveillance, they don't have any risk assessment, and they haven't got any proper PPE or any other controls in place, which is really quite sad to hear.
Yeah, so that really brings us to the key point, isn't it, Jenna, about health surveillance. This is about the legal requirement to identify and reduce health risks to employees. And the only way we can be sure that the health and safety controls are working is to carry out those regular health checks or the health surveillance on employees, so that the employer can see if there's any trends or work-related ill health which is developing.
Yeah, absolutely. I'll just move on to the next slide and hand over to Anna on what are the risks that health surveillance needs to cover, Anna.
So there's a number of health and safety regulations that require consideration of health surveillance. Janet's got some on the screen there, but they include the COSH regulations, so control of substances hazardous to health, asbestos regulations, noise regulations, and also vibration regulations. We're going to be moving on to this in greater detail in some future slides, but before implementing any health surveillance programme, it's essential that you undertake a thorough risk assessment. What you need to ask yourself is, are employees being unnecessarily exposed to hazardous substances or environments? For instance, is there a chemical that you're using at the moment? Is it necessary to use that chemical? Could you change that chemical to something that's less potentially hazardous to that employee's health? And then the more effectively you try to eliminate those risks or reduce those risks at source, the less health surveillance might be required. And that's just sort of a general overview of what you need to think about in terms of health surveillance risk. I'm going to hand back over to Janet.
Brilliant. Thanks, Anna. And I'm just going to take the slides down now. So let me stop sharing, because we'll just move on to a bit of a debate now. And I'll start with Alison, if that's okay. You're obviously overseeing the health of over 4,500 people across a myriad of different suppliers. So what are some of the misconceptions that you've faced when it comes to health surveillance?
I think, Janet, a lot of health and safety professionals have the focus on safety and they forget about the health element. They'll do a risk assessment for an activity, but forget to include, like I say, the health aspects. And the health surveillance data can help inform that. It can look at, are your control measures working? Are they not? Do you need to make any changes? So without that active monitoring and including the health surveillance data, you're not meeting your legal requirements. PAM are our occupational health provider, and they support us by providing that data to inform our practice.
Yeah, and that data is absolutely essential, isn't it? I'll hand over to you, Bernard, now. How does health surveillance work, and how often does it need to be carried out?
And that's a a fantastic question, Janet, because I believe there's a misconception out there in that, if they're doing safety critical medical, say every 3 years to check if their employees is well enough to do their job, then they're monitoring their health as well. But actually, health surveillance is likely needed on a more regular basis. Because here we're looking at trends, isn't it? So we just need to, that's why it's more regular, because you're actually looking at whether the exposure or that job is actually starting to affect the employee's health. So health surveillance works by looking at what risks an employee is subject to when being exposed, and if that exposure warrants such a surveillance. So with health surveillance, it normally involves taking a baseline measure of the individual's health as a starting point. Then it will be about scheduling in just enough ongoing follow-up checks to spot if there any deterioration in the health that might be due to the exposure in the workplace. So, for example, going back to the hearing scenario again, if it is getting worse between checks, then it can indicate that the noise at work could be damaging the individual's hearing. So then for the employer, it's to act on those findings to ascertain if the risk controls are working or not. For example, and if the employees are actually wearing their protective equipment properly, if at all, or maybe the type of protective equipment is inadequate, or the employee is not working in the right way. So I think these are just examples, but I think you have to look at it from a holistic point of view, which is leading us back to the initial point about a thorough risk assessment. So PPE, is just right at the bottom of that risk assessment hierarchy. So, but you really need to look at, as what Janet has mentioned before, whether you can engineer out specific processes or specific exposure to chemicals and that sort of thing. Yeah, so that's my thought. So, Alison, do you have anything else?
I think it's a really good point. So health surveillance can't be seen as a tick box exercise. It's got to be a way of identifying early any health concerns. In construction, we've seen a video of someone who was exposed to hazardous substances, didn't attend for any sort of health surveillance appointments, so wasn't aware that, the long-term effects on his health, and he then developed cancer. Even though they thought that he was working in the right way, there wasn't that assurance check on the activities and what he was doing and on him himself. And he wanted to make the video just to show people that they need to take health surveillance seriously. At the end of the video, it was really heartbreaking because it said that he died 2 months after the video was recorded from, the exposure. It was just a real stark reminder of how important health surveillance is.
Absolutely. Health surveillance is a legal requirement for good reason. Failure to implement it properly can lead to serious legal consequences. And obviously, on that individual himself, Alison, that story's heartbreaking. This isn't just theory, it is actually happening in real workplaces. So very recently, a foundry was fined £500,000 for failing to protect workers from vibration risks. Even after diagnosis, one of the employees kept using vibrating tools without any proper safeguards, and the HSE found that the health surveillance that was being provided was inadequate. The company hadn't acted, and this isn't an isolated case. There's many examples like this, and it is just a stark reminder that health surveillance is not about ticking a box. It's a legal and moral obligation.
Yeah, thanks for pointing that out, and I believe we are all in agreement here that it's also important, not to panic and do too much in inverted commas when it comes to health surveillance, because if the employer puts somebody on to the health surveillance monitoring, where there isn't actual sufficient exposure to that risk, then the HSC will expect justification, and because it may be deemed unnecessary. So it's one of those things, again, coming back to the risk assessment and be able to justify somebody being put on that program. Yeah. So, and sorry, Janet.
Yeah. So yeah, absolutely, totally. Everything that everybody's saying so far it just really resonates and makes sense. But we need to go back that sort of step forward. How do employers work out which risks need health surveillance? And I'll hand over to Anna for this one.
So it's about getting the risk assessment done properly from the very beginning, removing any, identifying your hazards, removing any risks that don't need to be there, then getting the right control measures in place. As Bernard said, the first thing you need to try and do is see if you can eliminate or substitute what is being used. And then from that, you'll determine who needs health surveillance to measure how effectively those control measures are working. And different risks will require different levels of control and different levels of surveillance. So it's good to work with an occupational health provider that can guide you through that process to make sure you're doing what you should be doing, you're compliant, you're doing the right level of surveillance, and you're not over surveying, because obviously that is a challenge. People can just sprinkle health surveillance everywhere rather than making sure that it's, only being done for the people who need it to be done.
Yeah.
Alison?
Yeah, I work with over 250 subcontractors, and it is about education. I do assurance activities with each one of them, and the level of knowledge and understanding can be very variable. I've had people, and these are health and safety professionals, ask me where in law it says that you need to undertake a hearing test. We're not asking them to do above and beyond. What I'm asking them to do is meet legislative requirements. So it's taken a lot of work and education to get some of these companies to where they need to be, to really understand the risks that they're putting their employees under, and put measures in place to protect them and achieve compliance.
Just talking about compliance, Alison, once you've identified the need for health surveillance and set everything up, you still need employees to actually turn up for their appointments and achieve that compliance. So why don't employees go to their appointments, Bernard? Are you able to answer that question, or at least give us some guidance?
Yeah, Janet, I think this is an issue really top down. Yeah. It's not only a legislative thing, but this is about demonstrating that the employer actually cares for the health of their employees. And they're taking this seriously. That makes business sense, with staff appreciation, retention, and so forth. So going back to the legislative side, an organization, can have all the processes and checks in place, and employees and managers, who want to do this. But if the leader at the top says, why are you bothering with this? Yeah, then the people won't take it seriously. So again, that top-down initiative or emphasis is what that is required. So business leaders do have to understand, that this is a legislative requirement and that it's the law for them to do it.
I understand that, Bernard. It's a common misconception as well that health surveillance isn't necessary for roles where people move on frequently. However, any work-related illness that does develop can potentially still be traced back to an employer and a specific job and time in that employee's career, depending on what exposures they've had. And employers can still remain accountable for that. I think the limit is, anything up to 10 years, even after the exposure has occurred. So, it's really important that people get it right and have that embedded safety culture, and as you say, caring for their employees. Alison, what are your thoughts on that?
I think when you look at safety incidents, they're usually immediate, but when you look at health, it can take, 10, 20 years down the line for anything to develop. And a lot of younger employees think they're invincible. It's not going to happen to them. They're not appreciating what the work that they do today, the effect that it might have in later life. I think they also worry that if a health issue is picked up, they won't be able to continue work. And I think they don't think about the adjustments and, that can be put in place to support them. It's really important that they understand health surveillance is about picking up those health issues before they become serious, and prevention. It is about prevention, so that the employers can look at the safety controls. And you also have to let the employees know that they have a responsibility in all of this. They've got a duty of care to protect themselves. It can't all be on the manager and the employer.
Yeah. It's just talking about that is really, makes you think about the younger generations who are really focused on well-being when they come into an organization, whereas actually just looking after themselves by attending appointments around health risks. And it's the same for the manager and the employer. Well-being starts with managing health risks. So just talking about that, Alison, what role do you feel that managers have to play in ensuring health surveillance remains compliant?
Well, one of the issues we've had is managers not releasing the workforce to attend their appointments, and we've tried a lot of different ways to encourage and support that. None of which were very successful. So what we've had to do is, if someone misses the health appointment, then their site access card has a ban applied, so they can't attend site and do work until they actually attend this health surveillance appointment. It was quite harsh, but it's working.
That's a really great way to get managers to treat health surveillance seriously. We've also seen other clients publish things like league tables showing levels of compliance with health surveillance appointments across different departments to get a bit of a competition going. We also support our clients to get their support the managers to get their employees to attend their appointments by sending out automated appointments and reminders. And we also, try to get people to understand how much money might be getting wasted with DNAs or no-shows, because obviously if there's a nurse on site or a technician on site and nobody shows up for the health surveillance, then the company still has to pay for that appointment. So, there's a financial incentive to get your employees to attend the health surveillance appointments as well. Bernard, what are your thoughts?
Yeah, thanks, Anna. Yeah, I think employers can also provide the training and education to their managers on the health and safety practices in order to raise awareness of what health surveillance is and how it can help to keep them and their people healthy, so that you create that culture, of health, as well as, building it, into their appraisals. I think that is a good way of doing it, is to take in, get this health surveillance bit into the employees' appraisals as well. So because some managers might not get much of that one-to-one time with their people, so if the employers make that part of the annual appraisal, then a manager can discuss how important this aspect really is, and also to visit the issue of the attendance, and talk about why it matters to their workers.
And that's a really great point, because that then brings it as a culture of health, a culture of health within the organization. If everybody is talking about it and everybody understands their responsibilities. But one of the things that we mentioned right at the beginning was around the data. The data is so important. And when it comes on to acting on the findings of health surveillance, what are your closing thoughts? And I'll hand over to Alison here first.
I think it's important to note that the findings are discussed with the employee at the time of the appointment, so they are aware. You know, we said before about employees having responsibility for their own health, but that information then typically goes back to HR or line managers. And I think it is best practice for, you know, whoever in the managerial position has a conversation with the employee about the findings. And then they're looking at, you know, if something has been picked up, are they wearing their PPE? Or, you know, is there a control measure that needs to be strengthened? So having that overall view, not just ticking the box, acting on the findings. Anna?
It's really important to understand and act on the data that's provided. What is the data telling you about that individual? Has there been any changes since their last assessment? And then what is it telling you about your organisation as a whole? Are you seeing any trends or hotspots? As Alison's alluded to, is there anything that needs to be strengthened or tightened up in terms of your control measures? And what action needs to be taken off the back of that data? You know, is there an impact happening on the health of your employees? The other thing to think about is something called corporate social responsibility, which is a big thing. And in some sectors, clients and customers can choose whether or not to work with you or another supplier if there's somebody who takes health and safety more seriously. So it can become harder, it can have an impact on things like recruitment of your staff, retention of your staff. So you really do have to use the time and invest in this to ensure that you're a safe place to work and become an employer of choice. Bernard, what are your thoughts?
Yeah, thanks. And I think this is the whole point about occupational health, isn't it? So if employers don't understand, you know, the risks that the employees are facing, and they're not prepared to ensure measures to protect them are working, then there is potential for the employees' health and safety to be compromised in the workplace. Yes, Janet.
That's very helpful, Bernard. Thank you so much. So thank you very much, everybody, for your discussion today and those last comments. And I think we've now come to question time. And we do have a few questions in the chat. We've also got a few questions. So the first question that's come through, I'm actually going to hand over to you, Bernard. Are office shift worker health assessments considered to be health surveillance? So that's, for example, your risk of fatigue, poor physical health due to sedentary work, and how often should those be done? Now, that's a juicy question, is it not? So thank you.
Thank you. Thank you. Thanks, Janet. Yeah, I think health surveillance is different in the sense, but I think where this piece may come under is, say, for example, the night workers, you know, legislation. I think because of the shift work and the potential of, you know, that night workers, and I assume there is night work involved here. So I think it's defined as, you know, working regularly at least 3 hours during the night period, which is 11 p.m. to 6 a.m. Then I think there is legislation that that the employer must offer a free health assessment before the employee starts night work, and that assessment needs to be regular. So now, if there's anything that is being picked up during that assessment, in that there's fatigue or there are symptoms, then I think that needs to be assessed by the occupational health team. So that I think is a method that you need to take up with the occupational health provider, because yes, this sort of shift working, night working thing does come under legislation, and there needs to be that, if you like, that health check. But I think this comes under separate rather than the health surveillance that we are talking about on this occasion. So is there any, from the panel, is there anything else you would like to add?
Yeah, I was going to just hand over to Alison, because you must get a few of these questions sometimes, with especially around the fatigue element.
Yeah, and I think Bernard's right. It kind of sits outside of health surveillance. It is about sort of that health check type of thing. And certainly the night worker assessment is voluntary. You only have to offer it. So yeah, separate to health surveillance.
I think people do get confused. So I'm really glad of that question, because the health assessment and health surveillance are two completely different things. And my understanding is that the HSE states there has to be a standardized test that marries a measurable risk. And our occupational hygiene colleagues will often go out and do things like noise measurements as part of that risk assessment, noise measurements or dust or fume measurements, etc. So there's a clear evidence-based risk with levels that will be. So for example, we know that there's a level of noise that people have to be exposed to before health hearing protection is provided and health surveillance is offered or has to be given. So it's a really interesting question, because I think people do often have that crossover between a health assessment and health surveillance.
Yeah.
Can I just add
Janet.
something else? Sorry, I was just going to add something else there. One of the things that I've come up against is that employers will issue their own health surveillance questionnaires and assess them themselves, and that just isn't right. You just can't rely on that. I mean, one, you've got confidential medical information, but two, you haven't got that professional doing that full assessment. So it's just to say that whilst some of the things like skin, you can have a responsible person that can do regular checks, the actual health surveillance needs to be carried out by health professionals.
Yeah, thanks, Alison. That's a really important point. And I suppose the next point will be relevant is that, if you're not clear, ask, okay? Just drop us a line or whatever it is. We don't mind taking questions from, other, organizations that we don't provide occupational health advice to. Just ask, hopefully we can answer your question. If you're not clear what is, a health check and what is health surveillance, just ask. Somebody will help you.
Okay, brilliant. Thanks, Bernard. We do have a few more questions. So the next question is from Keith, and it says, any strategies to get staff to complete their paper screening? So this marries with a little bit with what we were just saying. So there have 2 paper screen forms are issued out, but staff are not always completing them. So I know you haven't had a chance to answer the question yet, so I'll hand over this one to you.
I think getting the employees to understand how important it is for these questionnaires and forms to be completed, things like maybe as a toolbox talk, get everybody into a room, have that conversation with them, make sure they understand the importance, and that it's not about being punitive, it's about legislation, it's about risks to their health, and ultimately all you're trying to do is to protect them. We also talked about things like league tables, getting the managers involved, making sure the managers understand and appreciate the importance of doing these screening tests as well. And Alison, I'm sure you've got similar issues to what Keith has on his site. So have you got any additional things that you can suggest from your practice?
Yeah, I mean, one of the things that we do, so if someone doesn't say complete their hearing test, we'll restrict them from working in noisy areas until they do, or put that ban on and say, this is a legal requirement for us, so you must comply. Like I say, it is harsh, but it's got to be done.
Yeah, and I think it just sends a great message, doesn't it, that this is so important. I just wanted to go back to that point that was raised earlier about who's reviewing the screening questionnaire, because if employees don't trust the person who's reviewing it or are hesitant to provide that information, and I think it just, we're looking at construction as a point here. With many subcontractors, they self-employed, etc., or they may be part of a small organization. So just looking at the bigger picture, because if they're concerned about losing their jobs and reporting symptoms, that again is where education needs to come in and just look at that whole sort of process, if you like. And that's when occupational health can come in. We can support with that.
Yeah, I think the other point, Jenna, was I think maybe pertinent here is to the contract of employment of employees. One of the points to put in could be that engagement in health surveillance. Because of the role itself, they have to engage with health surveillance, and I think it may be pertinent to put that in the individual's contract. Now, I understand that it is covered under health and safety legislation, but sometimes people just don't understand. But they do understand when you stick it in their contract of employment. That so just wanted to raise that really.
That's actually a really great point. We haven't got any other questions in the Q&A, so please, if anybody else has any, please pop them in. We've got a few minutes left. Somebody's asked if they can share the link. But we did have a few questions that were sent in. Some of these we've covered to some extent, but I think one which is really good to ask is whether there are any gaps in somebody's health surveillance. How do they know, and what do they do about it? And again, I'll come to you on this one, Bernard.
Yeah, that's an interesting one, Janet. I think it all, again, boils down to the risk assessment and understanding, the employer's understanding of the workplace and their processes. So you would think that the employer would conduct an appropriate risk assessment, and that would be the way to identify, if health surveillance is required. Now, another way would be, to review cases of work-related ill health. So, for example, if cases were to be referred to occupational health, and the feedback is that, oh, look, there may be something here. Your employer has developed, asthma because of exposure to wood dust, and you've not conducted a risk assessment or looked into the area. So it may be time for that risk assessment to happen, or more analysis into that to see whether health surveillance would apply there. Now, and of course, having that conversation with your employees is also often a good way, because the employees, will be able to feedback and say, look, I think, my work is, causing me X, Y, and Z, or I feel that, exposure to this is leading to, symptoms X, Y, and Z. Now, if that is the case, then that should trigger an occupational health assessment for further investigation. And the feedback may well be that, this area or work needs to be looked into a bit more. And from that, the recommendation of, or rather the employer can conclude that, well, actually, health surveillance may be required here. And of course, there's the usual, discuss this with your occupational health provider, use their expertise, and they'll be able to, come in and, and work with you and, advise you. So I think, those are just some ways where the employer can, identify some gaps perhaps in the health surveillance.
I was going to say, I think, Bernard, you raised a really interesting point there about the investigations. Quite usually see there's a safety incident, and immediately an investigation starts. We need to be thinking the same way for health. There's a health-like issue, incident, that investigation needs to start immediately.
That's actually a fantastic point, Alison, because there isn't often parity with safety. Everybody always focuses on safety, and not very often on health. And we come across this so often in our practice. I came across a question from someone, not one of our clients, but they posted a question saying, I'm not sure what health surveillance I need, and I don't think that our occupational health provider is giving us the right information. And I thought that was very sad that they didn't feel that they could trust their occupational health provider. But occupational health providers are, are scrutinized just as much. We have to follow that legislation just as much. So we're not going to be, on the whole, not going to be suggesting anything that your employees don't need when they do need it. And that's my view. But if you do have any concerns, then there is the HSC that you can go to and have a look at. They've got fantastic information on their website, and they also have information per job roles, so you can go and have a look at manufacturing or construction or engineering or whatever the case may be, and that will give you some good guidance as well as the legislation itself. But do talk to your occupational health provider in the first instance. Any other comments on that, Anna?
I think one of the good things that we do with our clients is we, as a baseline, when we start in a contract, is we do something called a needs review, and that's where we come in and we look at things like risk assessments, we look at cost data, we can look at previous health surveillance information if it's available, and then we provide that advice in terms of, right, are you over surveying, are you under surveying, have you got things just right, what do we need to do to sort of move things forward to get into a good place. And I really enjoy doing that because it just helps to embed us within our clients and organizations that we work with. So yeah, getting up, getting out of the office and seeing what actually goes on, it is the best way to start. So
it is. I love that, Anna. So thank you so much for that. And it brings us beautifully to our next question here, which isn't a question around health surveillance, but it does marry in a little bit to doing a workplace needs assessment, which is, Elizabeth said she's seen some research that suggests that older workers are more likely to suffer fatal incidents at work in some industries, potentially due to age-related declines in reaction time and cognition. And what measures should employers put in place to protect and monitor an aging workforce in these areas? Anyone particularly want to answer that one? It'll take us a few minutes just to think it through, because it isn't a health surveillance question.
Yeah, I think the aging population is an issue, and I think this is akin to say, for example, your DVLA driving, isn't it? Now, obviously, as the person ages, that health check, if you like, becomes more regular. So I think, for example, if the person's role is physical or dangerous or hazardous or whatever it is, then I think that health check or that health assessment, now this is not surveillance, okay, that health assessment needs to be undertaken on a more regular basis. So what I'm trying to say here is that monitoring, and a review perhaps of their work as well. Talk to your employee, what can they manage and what can they not manage? Now, the thing is, we, in occupational health, we will assess their underlying health, okay, their health conditions, and their ability to function against that particular job that they have to undertake. Now, it may be that, their physical state, there are various ways where we can assess their physical state, maybe through a functional capacity assessment, that sort of thing. And if it is, not commensurate with the type of role that they are undertaking, then we would make recommendations to the employer whether adjustments are needed or not. But yes, with an aging workforce, it will become a greater problem. And I think this is where that assessment needs to be more regular, and the employer and employee will need to be open, in that, adjustments to the role may be needed as they go along with, the more regular assessments that we are undertaking.
Anyone?
I mean, anyone else?
Alison and Anna?
I mean, do you agree with that in the sense that I think in your sector, especially in the construction sector, that I think, I think this is what we are, increasingly facing, isn't it?
Yeah, I do agree. So we do have an aging workforce, and I go back to employee responsibility as well. So I agree, Bernard, that the more regular checks, but we're really encouraging employees to come forward and say this or that I've noticed, and have those regular checks highlight if they're having any difficulties.
I think this is it's a really good point, because some industries like construction, rail, fire, etc., they have those regular health assessments or health checks or safety critical medicals, and they will increase them. They have a set increased period as people get older. But I think this is also a big shout out for educating people on how to look after themselves when they're older. So that's that sort of health promotion, public health arena that occupational health has as part of their remit. So giving people the tools to understand how they can self-manage and improve, but it's also making it as healthy and safe workplace as possible. So it comes from both sides, if you like.
And let's not forget occupational. No, it's okay, Alison. Let's not forget that occupational health is a public health specialty. So we have got a duty of care to the wider population. So things like making every contact count, making sure we're giving that kind of health promotion advice at the same time as we're doing things like health surveillance, or we're doing things like management referrals. So we're supporting that individual. If we take construction, that there may be people within that arena who don't often go to the GPs, who may delay going to things like their GPs if they've got a niggle or they've got a worry. So we can't let that opportunity pass us by not to provide that information to people when we're having that contact. As they say, make every contact count. Sorry, Alison, carry on.
I was just going to say, going back to the question about sort of the ageing workforce and increase in incidence, I think that's a really difficult thing to correlate, because everybody ages differently, and whether ageing is a factor in the incident would be so difficult to identify.
It would be. But just going back to Anna's point, some of our contracts, I think including yours, Alison, we have physiologists and health and well-being experts that actually work on the contract and help support general health and well-being around musculoskeletal health, lifestyle health, etc. Supporting individuals, or aiming to at least give people the education on how they can optimize their health. But as we say, it is a two-way street. And I mean, I've seen in my clinic, a 65-year-old that could have beaten a 25-year-old in a race any day, because they really focus on their own health and well-being. So it is really hard to generalize. But overall, the research is, we have got an aging working population. There's no doubt about it. So thanks so much for that question, Elizabeth. You really
sorry, Jen, I just want to say that with an aging workforce, obviously there will be chronic illnesses will be more prevalent, which is why there is in general I'm speaking about. So I think that's where that closer monitoring of their health by the employee, perhaps through occupational health, will be pertinent.
Yeah, absolutely. So I think that's all our questions. So I'm just going to present again. Let me just check that I'm on the right slide, because knowing me, I'm probably not. Not. So I'll just move over to the last slide there. And there we go. So that you've got our details. For those that have asked, I have popped the Insight link in the Q&A there, so you should be able to go straight there to see the insights. We have recorded today, so I'll stop that recording any second, and that recording will be available in the Insights page. So let me just stop that. So thank you. So it just comes to me to say thank you so much, everybody, for attending. Thank you